So in recent years, there's been a huge uptick in our awareness of the importance of concussion, and I think that the reason for that is that we now understand that a concussion doesn't just happen when the force of the blow is strong enough to render you unconscious. A minor blow to the head, even if it doesn't cause any noticeable change in function, takes its toll, and it turns out that repetitive blows to the head over time add up to even more significant damage than a single blow might. And that's particularly the case with football players who, in almost every snap of the ball at scrimmage and every practice session, get hit in the head over and over and over again. And even if it's not a direct blow to the head, every time they run into another player or hit the ground, that's a sudden deceleration of the brain, and the brain is moving around inside of the skull, bumping up against the bony surfaces of the skull and suffering little bruises over and over and over again. So we refer to this syndrome as MTBI, or multiple traumatic brain injuries. And this results in a very significant syndrome of early onset dementia, significant changes in behavior, personality changes, changes in judgment and insight. And so we see young, intelligent, athletic men getting themselves into legal and financial trouble, probably as a result of having sustained MTBI, or multiple traumatic brain injuries. And we see these guys in the news all the time because they're getting in trouble with the law, and that's raising our consciousness level about the devastating impact of multiple repeated traumatic brain injuries. So this is an area of active investigation. My opinion as a neurologist that any blow to the head causes lasting, probably permanent changes in brain function. The more it happens, the more likely you are to suffer significant brain injury that will alter brain function for the rest of your life. That happens from the very earliest ages, and in fact, we're beginning to understand that a mild or moderate concussion in early life can have much more devastating effects on later brain function than a concussion sustained as an adult. And therefore, as a neurologist, I feel very strongly that it is not appropriate for young children to be engaged in activities where they're likely to sustain multiple TBI, MTBI. That includes football, where every snap at scrimmage is almost guaranteed to cause a traumatic brain injury to every person involved in the play. Any deceleration of the head, moving from full running speed to full stop in a moment, will result in a concussion-like injury. And it may not take its effect that day, but if it happens over and over and over again, the more times it happens, the more likely it is to have a permanent effect on that person, increasing their likelihood of developing dementia at a younger age, and certainly a greater probability of developing learning deficits, frontal lobe disorders like attention deficit disorder, autistic spectrum disorder, learning disabilities, behavioral problems resulting in greater probability of getting in trouble with the law at a younger age, making bad judgments, being involved in domestic disputes and so forth. So these are all problems that happen to people who have suffered frontal lobe injuries and have lost some of their ability to have good judgment and good insight. And there's no question that MTBI results in this syndrome in many, many people. And so one has to very carefully weigh the benefits of physical activity and engaging in team sports versus the high likelihood of that child going on to develop the neurologic sequelae, or the neurologic consequences of MTBI. And it's not just football. Soccer is also another sport where people don't think about the long-term and frankly devastating effects of heading ball day after day after day. In fact, many people who think about concussion injuries feel strongly that heading the ball should be outlawed in child soccer. And it doesn't do you any good to wear a helmet, because it's not the blow to the skull itself. It's the deceleration that happens when the ball comes in contact with the head. The brain moves inside of the skull, it sloshes forward and bumps up against the front of the skull. That will cause permanent injury. The course of action after a concussion in a child athlete depends on the severity of the concussion. If the child exhibits no neurologic symptoms and is within normal limits at the first examination, they probably can return to play immediately. If there's a loss of consciousness or any identifiable changes in function, so if they're complaining of nausea or dizziness, complaining of headache, can't see straight, don't know where they are, acting confused or acting bizarre, they should not be allowed to return to play. Every child sustaining an injury to that extent must be evaluated by a medical professional before return to play, and that medical professional should be somebody with experience and expertise in diagnosing the effects of concussion in young people. If, however, the concussion is of moderate severity, the absolute minimum time to be taken out of sports is for 2 weeks. And in general, that child should see a physician with expertise in diagnosing symptoms of concussion before they're allowed to return to play. At this point, there are no direct treatments that will make the injury go away. So the best treatment is prevention. Avoiding collisions as much as possible, using the appropriate protective gear, monitoring your players for any signs of injury to the head and immediately removing them from play if they demonstrate it. So prevention is by far the best treatment. If a concussion occurs, it turns out that the most important thing is to not allow it to happen again in the near term. So avoiding recurrent concussions can be, a repeated concussion in a short time frame can be fatal. There are many, many documented cases of young children dropping dead on the playing field after sustaining a second concussion in a short period of time. So you must follow your physician's advice about when it's safe to return to play.